very pleased to introduce Dr Qi Ong from the Emergency Department of the Royal Adelaide Hospital. Now, Dr Ong, there's been so many changes in COVID-19. I know you'd like to tell us about the information that you might give us today.
Sure, thanks, Paul. So before we answer any questions, I'd just like to sort of put out a disclaimer that the situation around COVID-19 is changing so rapidly that my views today may not reflect my views tomorrow, and they certainly do not necessarily reflect the views of all healthcare professionals in my field at the moment. But I guess my opinions today and my advice to you are based on what we currently know in terms of the best evidence that we have.
Pamela has asked, amid the COVID-19 global crisis, if both teacher and student are well, is it possible to conduct private instrumental, i.e. piano teaching, as long as all hygiene measures are taken?
So the answer to this may not be, I guess, as straightforward as we may think. I guess in a short answer, yes, of course it's possible, but with every social contact that we have in these times, there is a risk involved. And for every step or measure that you take to reduce that, in terms of promoting hygiene methods, it reduces that risk. And the best method, I guess, to completely avoid that risk would be with what we're doing now, so with video conferencing. When we talk about COVID-19, what we do know in this day and age is that COVID-19 can be transmitted and can be carried by asymptomatic people. So there are cases of asymptomatic carriers and there are cases of asymptomatic transmission. Although that only forms a small portion of COVID-19 cases, we do know that about 1 in 4 cases of COVID-19 is transmitted through asymptomatic manners. So with that being said, although you and your student may seem well, does not necessarily mean that one of you doesn't have the virus itself. In terms of measures to prevent transmission, we can look into things like hand hygiene before touching the keyboard, after a lesson, things like that, avoiding physical contact, wiping down keyboards and instruments with disinfectant wipes, and staying appropriate social distancing with 1.5 meters away from each other and things like that. So all those methods would effectively reduce your risk of transmission, but it does not guarantee, I guess, complete safety or lack of transmission because of these cases of asymptomatic transmissions.